And just remember, you're always asking for permission before you do anything. You're not just diving in and poking. You're always explaining what you're going to do, stuff like that. Okay? Don't forget those things. Okay, so let's start again. So again, you're going to hold, I would be holding like so, okay, kind of scooped under. But for sake of you guys, I'll hold here. So their shoulder's going to be an extension and slight abduction, and you're going to let their elbow flex. We're going to start with the medial epicondyle. That's on the medial aspect of the elbow. It's the biggest bony prominence on that side. Should be easy to find. Okay, and then moving laterally, we're going to get to the olecranon. So that's the pointy part of the elbow here. Okay, and remember this one, we can't actually feel the olecranon because over it we have the olecranon bursa. Okay, between the medial epicondyle and the olecranon, we have the groove in that area, which is where the ulnar nerve runs. Careful. So again, be careful with this structure because it's pretty prominent. If you hit it, you can get the zings and stuff. Okay? Okay. You can follow the ulnar border all the way distally till you get to the end. You should be able to kind of feel the sharp edge of the ulna there. So you get to the end, and it's the ulnar styloid process. Okay, it's the most distal part of the ulna there. Okay, back up to the olecranon, and we're going to find the olecranon fossa. So this one's superior and deep, so it's the distal part of the humerus. So again, you're going to have to play around with the amount of elbow flexion in order to get your thumb kind of deep in there. There's fatty tissue and the triceps tendon that kind of cover it. So. You guys got it? Okay, so from the olecranon, we're going to move laterally to the lateral epicondyle. So this isn't as prominent as the medial epicondyle, but you guys should feel a bony prominence there. Got it? Okay, and then you're going to bring their elbow to about 90 degrees of elbow flexion. Okay, and from the lateral epicondyle, you can move distally. Your book says about 1 inch, but I feel like it's less than that, to the radial head. Okay, this is the one when your patient pronates and supinates. Go ahead. You should feel it spinning underneath your thumb. If you don't, move a little bit proximal or a little bit distal, and you'll know when you're on it. Okay, underneath that radial head, you have your annular ligament. This is one of those ligaments that, again, you can't feel, but you should know that that's where it's located. Okay? All right.
Do you repeat that again, please?
Yes. Which part?
I don't know.
All of it? Okay.
From the point that you feel spinning on.
Okay, so you feel the radial head where you feel it spinning underneath your thumb.
Yeah.
The annular ligament runs over that radial head to hold it in place. So you can't necessarily feel it, but you should know that that's where it's located. Got it? Okay, good. Oh, and then you're going to follow the radius distally until you get to the most distal aspect. That's where the radial styloid process is. You guys got that? Okay, good. Okay, now we're going to do the flexor pronator muscle group. So this is the one where you can put your own hand. The thenar eminence of the thumb, the meaty part of your thumb, is going to go on the medial epicondyle. Okay, so there's 4 muscles that run there. I don't know if you guys learned an acronym to remember. Pascal, yeah. So P is going to be your pronator teres. F is going to be your flexor carpi radialis. P is going to be your palmaris longus. And F is going to be your flexor carpi ulnaris. Okay, so that's the way that they're running. And then you can feel them kind of as a whole on the forearm here. We're not differentiating muscle for muscle, it's just the muscle bulk itself. Okay, some people are going to have a little bit more beefy muscle there. Some people are going to be a little bit smaller. So compare side to side with your patient. Okay, so lateral collateral ligament is going to be the one that runs from the lateral epicondyle to the annular ligament. Okay, so it's running in this direction. Okay, so your thumb is going to strum up and down. You should be able to feel a bit of a rope-like structure there. And you're feeling for any tenderness or asymmetries. You guys got that one? Yeah? Okay, and then while we're in this position, we're going to look at the extensor muscle group. So that's the muscle bulk on this side. Okay, so this is the Brachioradialis and the extensor carpi radialis brevis and longus. Okay, this is the one where we can differentiate the Brachioradialis by having the patient push up on either a table or they can resist themselves here, and it's going to pop up. Okay, you guys got that? Okay, and then the last one, turn this way, is going to be the medial collateral ligament. This is the one that runs from the medial epicondyle to the trochlear groove of the ulna. So it's kind of running in this direction. It's a fan-like structure, and again, you can't feel the ligament itself, but you can palpate the area for any tenderness. You guys got it?
Yeah.
You can look in your anatomy book for that. Okay, you guys got it? Okay, since that took literally 20 minutes, we're going to do a little bit, and I'll still let you guys leave early. Okay? Is that fair? Okay. Any range of motion you guys want to review?
Scapular MMT.
Scapular MMT, you're going to have to ask Dr. P. Range of motion? Anyone? Okay. Can we have a volunteer?
Not again.
Not Chris again. Somebody else. If no one volunteers, I'm going to pick someone. So.
Okay.